So many of you guys want to have a natural birth. Now, I say natural because it really depends on you what natural means. Honestly, a lot like when you go in the grocery store and something says all natural, we don't really know what that means. We have to dive deeper into the ingredients if it's something that really matters to us. So today I'm going to tell you the most important things to learn about before going for a natural hospital birth. I think these are really important and they get skipped by a lot of classes that market themselves as natural, kind of like at the grocery store. So let's jump into it. And I want to be really clear that this comes from seeing thousands of patients have their baby, a lot of them natural. At the first hospital that I delivered at, the majority of patients actually did not get an epidural, just kind of where the hospital was, the ethnic makeup of the patients in the hospital. So early on, I got very good at helping patients who did not have an epidural cope with natural birth, that being ones who didn't get an epidural. Now, natural can also mean not getting induced. Natural can also mean absolutely hands off in the hospital. I hear of people who say, I'm going to have my baby in the hospital, but I don't want them to touch me at all unless it's an emergency. That's something you'd want to review with your doctor. So I'm just telling you that natural is a really big spectrum. But the reality is you want a natural hospital birth, which is very different than maybe a natural home birth, or if you are going to go out into a wooded field and have your baby out there. So a natural hospital birth needs different skills and techniques to keep it natural in the hospital. And that's what we're really going to talk about. Now, I just want you guys to define what natural means to you. And I think doing a birth plan really helps you figure that out. I actually have a whole free birth plan mini series that you guys can grab down below. It's going to help you go through a birth plan, decide what's natural or important to you, because I got to tell you, there's a lot of people who think it's natural because I'm not getting IV pain medication, but I'm still getting an epidural. Whatever it means to you, I'm here for it. Just make sure that you know what it is. And I would encourage you to take your birth plan to your provider early on. So even if you're just in your second trimester, I don't think it's bad to take that birth plan, maybe put it in pencil in case you change your mind on a few things, to your provider, or reprint it out because you're going to have the full copy at home if you grab my free birth plan mini series. Now, I do want to give a big caveat on this one. There are a lot of people who market themselves as natural birth coaches or whatever. One of them I saw promoting online that you could bring your own tub into the hospital and every hospital should accept it. And I was like, heck no. First off, my first hospitals that I started in were in California. So they have very specific loads that they are allowed to put on every floor due to earthquake precautions. So if you're filling up a giant tub in the labor room, that adds a lot of weight to that floor and it might be something that they cannot accommodate. In addition to the fact that your tub might end up having a problem and then you've got leakage around the whole unit, which would be bad for the patients below you and the patients on the same floor as you. So those are things to think about when you're watching people who are talking about natural online. Make sure that you're learning from an expert and someone who lives in a land of realism, because while they always say, oh, the hospital policy, you can do whatever you want, not on bringing stuff in. You can't bring a gun in and you likely cannot fill your own birth pool in the labor room. Some places you can. My last hospital, you probably could have been able to do it because we were on the bottom floor and it depends on the size of the birth pool, but it's something that you want to bring to them because there are going to be some hospitals who are like, no, just FYI. And I also want a caveat to say that natural doesn't always mean the safest. Obviously, you're just choosing to deliver in the hospital, and that's why you want this barrier of safety around you. And so sometimes the natural things that people want to do conflict with maybe what your providers want to do. Again, take that birth plan to your provider so that they can go over it with you and just kind of set expectations with you, and you can set expectations for them, because most things, besides bringing in your own birth pool, are up to you. Okay, the first one, and the one that gets top billing, is to practice and learn natural pain management techniques. Now, you'll notice that I said practice and learn natural breathing techniques. A lot of classes, people just go through the natural pain management thing and then they think, we done. We don't need to practice these. But I'm here to tell you that that is just the beginning. You're going to want to learn those videos and practice them as you go through, your whole third trimester. You get a bad ligament pain, that is an awesome time to practice those relaxation techniques, because I'm here to tell you that some of my ligament pains were just as painful as actual contractions. So practicing those will not only help alleviate that ligament pain. By the way, want a video on ligament pain? I'll link it down below. but it will also help you practice those things so that when you get into labor and you are in pain, they will be natural to you. What a good natural thing to have. Now, natural pain management techniques include breathing, they include positioning, because movement is going to be your best friend in labor. Even if you have an epidural, it's still your best friend in labor. And other pain management techniques, massage, other things that you can do, ways to use other coping techniques like the comb or when to get in the shower, things like that. Now, I believe all of these things are super important. I'm not here to put down any of those or to say that you shouldn't be learning any of them, but I do think that a lot of birth classes have been melted down into just breathing and natural pain management techniques. And as you find out, as we go through the other things in this video, it should not be the main thing that you're learning. Now, you're going to be practicing those things all along, right? But if 95% of the birth class is just natural pain management techniques, you're going to miss a lot of the other things. And I got to say, I think providers were like, great, don't get an epidural, but don't learn any of the other things because it makes you a more difficult patient to manage, maybe back in the day. And so learning these other things are just as important to getting the natural birth that you're hoping for. The next one is a natural birthing class should discuss briefly the physiology of birth. And I actually have a whole video on the stages of labor that I'm going to send you guys to because it has the most important thing to know about the stages of labor. So you're not going to want to miss that video. I'm going to link it down below. But knowing the basics of kind of how labor progresses is awesome. But you don't need an hour-long class on the physiology of birth. That really is up to your birth team because however your labor goes is how your labor goes. It's important for us to know the basics and how it should be going, but you really only need to know how your labor is going. And again, use those experts that you're employing, your doctors, your nurses, anyone else that's on your team, to help you kind of know where labor is going and make sure that you're on the right roadmap and that things are progressing well. I know even when I had my baby, I'd be like, are we doing okay? Are things progressing okay? Totally normal to wonder and think those things. And again, watch that stages of labor video. I'm going to link it down below. It's going to be really helpful for this part. Okay, the next one, which a lot of birth classes are sort of light on, is to learn about possible hospital interventions. This includes inductions, this includes C-sections, and in fact, it also includes an epidural because you don't know what kind of pain you're going to be in when you get in there. Even if you've had other babies, this baby might be different. And just knowing about the epidural helps give you some basis of knowing if it's right for you or not, or what to expect if you do end up getting the epidural. And I actually have a whole video on why people come into labor and delivery and end up getting an epidural even though they weren't planning on it. And I'm going to link that one down below for you as well because it's important to learn about all of these things. A lot of birth classes just say no to all those things unless it's an emergency. But let's talk woman to woman here. If you noticed that your bathtub was starting to leak, you wouldn't wait until the floor was starting to cave in before you called a plumber, right? You would try and catch it early on. And I believe the same thing is true in labor and delivery. You want to know about the different things and maybe take interventions before it's an emergency. Just something to think about. And I think that's something to keep in mind. Now, the interventions they should discuss are things like if you should get your water broken, should you be using an IV? And a lot of natural birth classes are going to be like, no, you don't need an IV, but you really need to understand it. It's really important. And again, when you should use an epidural, inductions, C-sections. And as I was writing this post, this whole thing comes from a post on my website. I was thinking that even the very best doctors that were extremely patient, really involved in helping reposition patients, still have a C-section rate of 15 to 20% because stuff happens. Sometimes babies just will not descend. So that is still 1 in 5 patients, even if you have everything set up with an amazing provider, that you could still end up having a C-section. So it's important to know about it. That's a 20% chance just in case it happens. And I'm not saying you need to know how to do a C-section. The birth class that I recommend, the C-section chapter, is just over 15 minutes long. I recommend everybody watch it. And people have raved about the fact that they did watch it because it ended up happening to them. And they are so glad that they were just a little bit prepared. It really helps to know what you might be going into. And again, I think a lot of people just want to have a head in the sand approach to a lot of these things. Epidurals, inductions, C-sections, and that head in the sand approach ends up causing birth trauma. It doesn't make for better births, and I'm here to say that you're not going to manifest the birth if you just don't think about the other things. That's just not how things work. as someone who's seen thousands of patients give birth. Oh, and do not get me started on the birth class pages that start with "get your perfect birth." That is a huge red flag for me. That shouldn't be something that they market because it's not something that we can give you. Getting prepared for your birth, feeling confident, those are things that they can give you. But getting your perfect birth or following your exact birth plan, no one can give that to you except for Mother Nature. And sometimes she's just not on our side. And I do want to say that I think a lot of birth classes ignore this topic because they don't know that much about it. They don't know that much about inductions or C-sections or frankly, even epidurals because they're taught by doulas or childbirth educators who have never experienced that or have not seen a wide variety of people who experience it, which is why I recommend a birth class taught by a labor and delivery nurse. I actually have a bunch of birth classes that I recommend in a video, and I'll put that link down below as well. The next one is to learn about third trimester testing. And so many classes don't go over this at all. And I think it is the point where a lot of birth tends to kind of go off the rails because you go in for your appointment, you find out the baby's a little bit small, and your provider's like, let's get an ultrasound, right? So you get the ultrasound and then your provider starts to be like, I think we should probably induce you. This is showing that baby's just not getting adequate blood flow to really grow and thrive in the womb. And you have no idea that that might have even been an option because you just went in for an ultrasound. And so learning about third trimester testing and the choices that you might make after the third trimester testing is so important. I actually have a free chapter of the birth class that I recommend that you guys can get down below. It goes over what to go into the hospital for, like emergency signs, as well as third trimester testing. So you know what it is, and you're gonna know how to make choices with the results. So important that you guys know these things. And I gotta say, when I started in labor and delivery, very few people were getting third trimester testing. But here we are in 2026 when I'm filming this, and I would say half of the unit ends up having kind of these surprise things in their third trimester where third trimester testing showed they probably are safer off inducing their baby. So learning about third trimester testing is super important. You know, even if you're in your second trimester, I would still learn about it. Things that might cause this: high blood pressure, preeclampsia, cholestasis, baby being too big or too small, or too much fluid or too little fluid, measuring off, things like that. And so I actually go through some real life scenarios where people are having this happen to them and they're having to make choices in my best tips in the labor room or insider tips. I'm going to link that one down below. It's totally free as well. Lots of freebies on this video. You've got the birth plan series, that free chapter of the birth class I recommend, and those insider tips. So again, they'll all be down below. Okay, all of this has sort of been culminating into this big one that you need to learn about, and that is how to make choices for you when the time comes. There's so many people on social media or perhaps even creating birth classes who are just like, C-section, hard no unless it's an emergency. But the reality is you need to make choices in the moment. It's not something that you can make way ahead of time. I actually have a whole video on making choices that I'm going to link to down below. But learning how to take the information from your experts along with what you're hoping for with your birth plan and trying to reconcile those two things is really important. There is a whole lot of gray area in labor and delivery and obstetrics. And so, most of the time it's not like you have to be induced today, but it's something that they can put on your radar and you can start to think about, and you can make the choice when, your labs or your blood pressures are enough that really you should be going to get it. And a good natural birth class should be doing just that. It's not putting your head in the sand. It's not just giving hard no's when you're not actually even in labor. It's learning to make those choices and learning to make them with your partner, because it's so nice to have somebody else who has some skin in this game with you. And then the final one is having appropriate expectations. Far too many people come into the hospital thinking it's going to be one way and then have a rude awakening that it is not like that at all. And I'm here to also say that postpartum, your expectations may be completely off. People only show a very small part of postpartum. And I, for one, was completely unprepared. I have a whole video on it. I'm going to link it down below. But setting expectations with an expert can be a big win and so important. And a good birth class should be doing just that. And a few other notes. I see that when people offer a natural birth class, it tends to be more pricey. In addition to the fact that I see people who add any advertising on Google or Facebook or any of those platforms, their birth class price is probably double. So the birth class that I recommend comes in at under $100. Again, I will link that class down below, but you should be looking for a birth class that fits your budget. And just because it's natural doesn't mean it should be more expensive. Again, this feels a lot like the grocery store here. Be sure to check the credentials of your teacher. You're looking for somebody who has initials. I don't recommend classes online taught by a childbirth educator because it's really hard to vet them. And frankly, doulas can be really hard unless you followed them for a long time and you really trust them. Of course, you can also be an RN with zero labor and delivery experience. So looking at experience and credentials is really important. And another pro tip is to check to see if they have any free options that you can go through to see if you're a good fit, because not everybody is a good fit for each other. And I'm glad we have these free options for these online courses anymore. They can be really helpful. And that can include YouTube videos like this one or other freebies that they offer on their websites. And if you're looking for some free classes, I actually have a video up above and I'll link it down below that goes over all the free classes. Frankly, guys, I'm so thrilled that you guys are even thinking of a birth class. Studies show that it does decrease birth trauma, decreases C-sections, decreases inductions. It's just going to make for a better birth. So I'm so glad that you guys are here. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.